Hello, my name is Jordan. I will be your nurse today. I'm gonna sanitize my hands here. Hand hygiene. Can you please state your name and date of birth for me?
Hannah Chandler, 10/21/1999.
Can I check your wristband, please? Perfect. It looks like the doctor put in an order to for your integumentary system assessment to check your skin, all over. Do you have any allergies?
No.
Perfect. For this, I will not have to wear PPE unless I'm assessing your skin and you have any open wounds or anything like that, then I would wear PPE. So I'm going to do a little brain dump here for a second. I think I have everything. Okay. All right, so I'm going to ask you a couple of questions. Do you have any rashes that you're aware of?
No.
Do you have any parts of your skin that has changed color that you've noticed? Okay. And then do you have any skin allergies that you're aware of?
No.
Perfect. Okay. So I am going to assess your skin and just take a look. Can you please remove your shirt for me? And your shoes and socks, please. And all my equipment, everything is clean and ready for use. All right, so right now I'm looking at your skin here, just inspecting right now. Skin color is uniform for the patient all over. Looks good. It's like a pink, regular color. And next I'm going to inspect the patient's mucous membranes. Can you go like this for me? Conjunctiva, looks good, pink, so that's normal. Can you open your mouth for me? Looks pink and good. Tongue is normal color, pink, nothing abnormal on patient's tongue, no black, hairy abnormalities there. Next, I'm going to inspect for edema in both left and right, bilaterally. I don't see anything. I'll palpate for edema after inspection. Looks good. Let me check your back. Looks good. All right. Next, I'm going to check for any lesions, bruising, rashes, anything like that. I know you stated you don't have any rashes, but I'm just going to look. Just gets a line here from the sports bra. No bruises or lesions. If they did have any open wounds, I would wear PPE, but I don't have to for this. And feet, hands look good. Perfect. All right, so let me check that off. Next, I'm going to be looking at your nails. You hold out your hands for me. Looks good. No cuts or anything like that. The texture is smooth. I'm checking both hands. Now the feet. Nails look good, smooth. Patient does have nail polish on the toenails. Next, I'll be checking your skin temperature. And I'm going to be using the dorsal part of my hand. Patient doesn't feel warm. Feels good. Feet are a little cold. All right. Looks good there. I'm going to check for skin turgor. So for this, I'm just going to kind of pinch the sternum here. Looks good. Goes back to normal. Now I'm going to check for moisture. Seeing if your skin is hydrated. Looks good. Looks good. All right. Check that off. Now I'm going to check your skin's texture. It is smooth and supple. No abnormalities with the skin. Texture here. Looks good. All right. And we did the moisture. So now I'm going to be checking bilaterally for any edema, if any is present, okay? All right, okay. So it looks like their patient has no lower leg edema or upper edema. Let me check your stomach here. Abdomen, no edema here. And the feet, no edema present. The scale for edema, it starts with trace, so that would mean minimal depression. +1 is 2 millimeter depression. 2+ is a 4 millimeter depression, and it disappears within 10 to 15 seconds. A 3+ is 6 millimeter depression, lasts 1 to 2 minutes. 4+ is 8 millimeter depression, and that lasts 2 to 3 minutes, or grossly edematous. And the patient has no edema, so. All right, I assessed nail texture. It was smooth, nothing wrong there. Now I'm going to check for capillary refill. So I'm kind of going to pinch together to see blood return when it comes back right away. So that looks good. That looks good. Now I'm going to check the toenails, and she does have nail polish on, so I'm partial nail polish on, so I can still see capillary refill. Looks good. All right. Since I did touch, I'm going to just resanitize my hands here. All right. And that is your skin assessment. Everything looks great. I do have time. Do you have any questions for me?
Nope.
Okay. So here is your call light right here. Bed is lowered and locked. Side rails are locked. Pathway is clear for risk of falls, so no falls. Everything is clean and sanitized and ready for use. And if you have any questions, please call. Thank you.